Thank you, Governor. Good afternoon, everyone. Hope you had a good weekend. Let's get started on our data for today. As of 11 o'clock this morning, we know that we have 6,975 cases here in Ohio, now in 86 of our 88 counties. Our deaths are now at 274 in the state of Ohio. 46 of our counties have reported at least one death. Next slide. Again, we're updating our statistics for you on our website. More and more data there each day. Still pretty much skewed, slightly more females who are cases. We know more males who end up hospitalized. And then we are breaking our cases down by the old definition as well as the new CDC definition of a case. And what we're doing, again, is really following the trend. The good news is we're staying flat. Just like our curve has shown, we seem to be having a very, very flat, steady peak. We're still at that peak, and it's very stable at this point. 65,000 tests have been done to date in the state of Ohio. Next slide. These are useful too. You can get better look at it than you probably can on screen here, but this shows our 5-day trends on most measures, staying very steady. Again, it's still tough out there, especially in our congregate settings. So these are the settings like nursing homes, like prisons, in places where people live in certain communities in more close proximity. We know this virus is very contagious, very deadly, spreads quickly when people are in those settings. So that is something we're going to talk a little more about today. Next slide. Okay. So as Governor DeWine said, we are doing an order today. I think it's very, very important. We've known all along that nursing homes were going to be a very high-risk place for us in Ohio, as it is everywhere around this country. Once again, similar to our prisons, we have some great leadership who've been working all along. We don't talk about it every newscast or every press briefing here that we have, but we've had teams working tirelessly on all of these topics all along. I want to tell you more about it. First of all, our prisons have been under the Director Annette Chambers-Smith, who's really a renowned expert in healthcare and prisons. And we don't just work alone in this. We work with all our sister states, with the federal government, with the White House, on trying to make sure we're always doing the best practices. It is an evolving disease. People have had to work hard against shortages, like shortages of testing and shortages of PPE. That we are doing the very, very best we can in these hard areas. We also have Directors McElroy, or Sal McElroy, who you've met before in aging, and Director Maureen Corcoran, who's our head of Medicaid. They've been leading strike forces along our medical directors, Dr. Mary Applegate, Dr. Mark Hurst, and alongside our Bureau of Infectious Diseases. So whenever there's an outbreak in a high-risk area like this, the local health departments work alongside those facilities to do that very basic disease investigation that we did in the beginning. You test right away, you see who is in contact. And we've been working with guidance for weeks now, really, on how to best make use of scarce PPE, how to keep that from spreading in your facility. But we know these will be our hot spots, and as we move forward in the months to come, these are areas that we have to keep close tabs on. And again, this is work that we are doing day and night. We're working alongside the industries and all the leaders in it. I want to again do a shout out to the people who work. The staff in these settings are truly the heroes. They work tirelessly day and night on behalf of the people we love, and we want to do everything we can to protect them. So similarly, we've been collecting data. It's been in our charts all along about the percentage of cases that we see in long-term care facilities, and we are going deeper than that. We will be sharing with you the names of these facilities, but I want to tell folks, proceed with caution. It's really, really hard. It's not the fault of a nursing home. Most nursing homes are doing an outstanding job, but it is the fact that this disease is so contagious, and as even workers or caregivers come, even as doctors were visiting these nursing homes, any one of us could asymptomatically be carrying this virus from the community into a place like this. That's why we have so many of the rules in place. But it's so important to know that once we recognize it, we do everything possible to control the spread of infection. And these facilities are working very tightly with all our hospitals as well. So these are new partnerships that have been formed. People are not competing. These are not competing businesses like they might have been in an era before this. Everyone is all hands on deck working as best they can. But I want you to know it's very important, especially to the media, when a nursing home has an outbreak, when we report this, there's a lot of stigma, there's a lot of fear. If you remember back to one of the initial nursing homes that had an outbreak in the Dayton area, we had food delivery trucks who wouldn't even drop off the pallets of food to the nursing home. This isn't what we want to create. We want to create, once again, do 5 each day, just like Director Chris said. We want to reach out to these facilities. We want to give them our love and our support. They need us now more than ever. So I just think it's really important as we look at this data, it's not a blame game. We've really got to get away from that. This is about how do we help game? How do we do more? How do we do better with what we have? And that's what we're deeply committed to, and that's what the governor is deeply committed to. Finally, I want to say that my team, alongside the entire government, this whole weekend with people from the private and public sector, have been working, as they have been for weeks, on what our next stage of this looks like. We know it's a long haul. It's very hard to say the truth that we are not going back. We are not flipping a switch and able to go back the way we came in. We have to be very, very careful as we move forward. But I want you to know teams worked entirely all weekend. I know the governor will be sharing, and Lieutenant Governor, more and more details about that. We've been working even today on calls with my peers. The governor was on calls with all the other governors. President Trump and the White House are working on this. How do we begin that step backwards to something that we can, in this period before we have a vaccine, really keep us all safe, but try to find our way back in some ways to normalcy? So I want to say one more thing. These masks that we are wearing, and I saw them everywhere this weekend, everywhere I went, Ohio, don the mask, don your cape. These masks are actually now being viewed in the studies that are being done as yet another weapon to get back to normalcy. This is a culture change for us to do this, but it's actually acting very much like the other social distancing actions we took. This is like another layer, for those of you who've been following all along, another layer of Swiss cheese, not doing mass gatherings so we don't spread the disease. Our closing of schools, a very, very hard policy decision. We are going to be looking at a year of using these in new ways. So keep making them. Go on our website to learn how to do them safely and wear them safely. This is something we are all going to get used to, but I know even our businesses, our top businesses around Ohio, know that making workplace the safe place will be different. It will be taking into account all these things we do. And these masks, in every Ohioan, no matter who they are, having access to them is going to be important. Similarly, in the week to come, we're going to talk a lot more about our work on vulnerable populations. It's essential that we make sure that everyone is a part of the recovery. And we have new leadership in Director Alicia Nelson, who's leading a task force on making sure that our most vulnerable and minority communities are well represented as we move forward. So many, many pieces are in place. They're really starting to come together, and I look forward to sharing more details with you over the week to come. Thank you.